Hi, thank you so much for joining today's presentation on the lymphatic system. At the end of this presentation, you should have a better understanding of the subtle symptoms of a congested, sluggish lymphatic system and what can happen if you don't address it and start supporting it. You should also have a better understanding of the lymphatic system and all of the tissues and organs involved in it. So our medical disclaimer, I am not a medical doctor and I'm not providing any medical advice. This presentation is for informational purposes only. Always seek the advice of your physician or other qualified healthcare provider with any questions that you may have regarding a medical condition or a treatment and before undertaking any new healthcare regimen. Never disregard professional medical advice or delay in seeking it because of something you have heard or read in this presentation today. So today's agenda, we'll start off with the lymphatic system, the functions of it, how does the lymph move throughout the body, questions to determine if you have a congested lymphatic system, subtle symptoms of a sluggish lymphatic system, long-term complications of a congested lymphatic system, what is the BallancerPro, who would benefit from it, the benefits and experience to what to expect on a treatment, home care options, and our memberships at the Covery. So what is the lymphatic system? It is part of both your circulatory system as well as your immune system. It has a number of key functions in the body, protecting your body from illness-causing invaders, maintaining your bodily fluid levels, absorbing and transporting the fats consumed in your digestive tract, as well as helping to remove the cellular waste byproducts. Commonly, the lymphatic system is a forgotten system until it starts to act up, and many clinicians often forget the importance of it. So if there is any blockages that occur, disease can arise, and blockages can happen for a number of reasons, and it isn't until illness starts to rear its ugly head that we begin to think about supporting it. And this is a nice little image of the human lymphatic system. So it consists of tissues, vessels, and organs located throughout the entire body, and it helps to move a colorless watery fluid called lymph back into our circulatory system. We have on average about 3 liters of this fluid, which needs to be returned to our bloodstream daily. It collects this excess interstitial fluid among our tissues, removing it from the tissues themselves. It helps to filter the lymph and adds needed immune cells based on the pathogens that are present. It will then deliver the fluid back to our cardiovascular system, becoming blood plasma at this point. And once it's blood plasma, our toxins and waste byproducts can then be eliminated by our liver and our kidneys, while the needed immune cells are being delivered to the tissues to help fight off the pathogens present. And this is a great little video for you to watch that explains things better.
Let's say you're at the airport. You're waiting in line to get through security. You're in your socks, in public, and you're wrestling with those plastic bins, and people are yelling at you about dumping liquids and taking your laptop out of your bag. But even with a certain amount of chaos, the line moves pretty quickly. I mean, it should, theoretically, because really everyone has the same goal, to get to where they need to be. Now, you probably think at this point that I'm setting you up to talk about stress or anxiety or something, but I am not. Instead, I want you to imagine that security line as being like your blood, moving through your high-pressured circulatory system. And you, my friend, are not just some impatient traveler in a hurry to catch the next plane to Seattle. You are a bit of blood plasma. And the biggest concern of everyone in your queue is just to get delivered to their destination. But the problem with rushing stuff through a blood vessel or through a security line is that if it moves too fast, you run the risk that something bad might get through. So in the case of the line at the airport, every now and then, the security people funnel some random folks over to a slower line for a full pat down and a bag check. And that is kind of what your lymphatic system does. It takes up some extra fluid, and while it's ultimately helping it get to its destination, it runs a background check to make sure it's legit. It may not be as well known as some of your other more popular organ systems, but your lymphatic system quietly plays a vital supporting role to both your cardiovascular and immune systems. For one thing, it maintains your homeostasis by eventually returning most of the fluid that has been diverted back into your blood, which is good, because if it didn't, your ankles would swell up like balloons, your lungs would fill with fluid, and your blood volume and pressure would drop to the point where your body would just just give up and you die. But the lymphatic system isn't just another security line. It also has a series of checkpoints that are staffed by special security officers that have the ability to take care of small infections on the spot. Or if they really don't like the looks of what they've found, they can alert the whole immune system to take it down. So for keeping your blood volume levels where they need to be, for keeping you from collapsing from low blood pressure, and for preventing you from dying from a staph infection every time you scrape your elbow, you have to thank the unsung hero of your anatomy, your lymphatic system. Structurally speaking, your lymphatic system consists of three main parts. The first is just your lymph. It's a watery fluid that flows through your lymphatic system. Much of your lymph starts out as blood plasma that gets forced out of your capillaries, way down in the capillary beds, where the leakage helps the exchange of nutrients and gases between the blood and the capillaries and the hungry cells in your tissues. The blood capillaries reabsorb some of the fluid, but a lot gets left behind. So much of the rest of your lymphatic system works to soak it up and get it back to where it needs to go, inspecting it along the way. For example, you have a network of lymphatic vessels that help reabsorb the fluid, and about 600 or 700 lymph nodes, which are basically checkpoints that monitor and cleanse lymph as it filters through. Then there are special lymphoid organs like the spleen, thymus, adenoids, and tonsils, as well as other lymphoid tissues throughout the body. Some of these organs and tissues have special defensive cells of the immune system to fight infection by gobbling up bacteria and other harmful antigens, all of which we'll get a lot more into in upcoming lessons. Others, like the thymus and spleen, provide a nursery for maturing immune cells called lymphocytes. But to understand the special supporting role that your lymphatic system plays in your body, let's start with its origins in the capillary beds of your circulatory system. You'll recall that these beds are where the capillaries carry blood from your arterioles and your arteries before that, and feed blood into your venules and eventually your veins. This is where the transfer of nutrients and waste takes place, as blood pressures force plasma out of the arterial end of the capillaries and into the interstitial fluid between the cells of whatever tissue you happen to be in. And most of that fluid gets drawn right back into the capillaries on the venous end, thanks to osmotic pressure. But some is left behind. Of the 20 liters a day that's forced through the arteriolar end of all the capillaries all over your body, only 17 liters is taken back up by the venous end. Those other 3 liters, that becomes your lymph. It's almost immediately picked up by nearby lymphatic capillaries that wind their way in and among the blood capillaries, and they're really well suited for their job. Lymphatic capillaries are made of loosely overlapping endothelial cells that look kind of like roofing shingles, forming little flap-like valves that only open in one direction. So when the pressure in the interstitial space becomes greater than the pressure inside the lymphatic capillary, the flaps push open and take in fluid to relieve the pressure. Once the fluid is inside a lymphatic capillary, we can officially call it lymph. Then it flows through successively larger lymphatic vessels to collecting vessels and the larger trunks, and finally into one of 2 big ducts that feed back into the lowest pressure area of the circulatory system. The right lymphatic duct drains all the lymph collected from the upper right area of the torso, as well as the right arm and the right sides of the head and thorax, and feeds them all into the internal jugular vein. The larger thoracic duct takes lymph from the rest of the body and dumps it into the subclavian vein. Overall, these vessels work a lot like your veins do. They operate under very low pressure, have a series of valves that prevent backflow, and are helped along a bit by smooth muscle in the vessel walls that keep the fluid moving. Okay, so the lymphatic system takes extra fluid that's squeezed out of the blood capillaries and basically mops it up. That sounds handy, but as a living thing that wants to stay alive, what's in it for you exactly? Well, remember, we're talking about recovering 3 liters of blood fluid per day. That's more than half your total blood volume. If that weren't returned to your circulatory system, you'd be looking at a serious drop in blood pressure and little to no oxygen delivery or waste pickup. Plus, any blockage in the lymph system, like from a tumor that obstructs one of your vessels, can be really dangerous, resulting in edema or swelling that can constrain blood flow and lead to serious complications. And finally, don't forget that your lymph also plays a key role in the function of your immune system. Say you scrape your elbow and some bad stuff, like the staphylococcus bacteria that's covering your entire body right now, infiltrates some of the loose areolar or connective tissue under your skin. Since that tissue is full of interstitial fluid that drains into your lymphatics, which ultimately drain to your heart, you're going to want to vanquish those bad guys before they have a chance to wreak any havoc. Whatever will you do? Well, this is where your lymph nodes come in. Your body's main lymphoid organs, the lymph nodes, are where your lymph gets close and regular inspection by its resident immune cells, lymphocytes. Depending on what kind of troublemaker they find in the fluid, the lymphocytes might trigger the release of resident macrophages to attack unwanted microorganisms, or they might activate the general immune system outside of the node if they need extra support. The details of how that that happens, we will get to next time. But for now, just understand that lymphocytes are found in and mature in the loose reticular connective tissue that makes up a large part of the nodes and most of your other lymphoid organs. Now, if a node is overwhelmed by whatever invader it's trying to quell, it may become inflamed. You can actually feel some of your nodes if you poke around the sides of your neck. They feel like little bumps, Yeah, there they are. And noticeably enlarged lymph nodes are often an early diagnostic sign of disease or infection, which is why doctors are always feeling around under your jawline during checkups. But your lymph nodes aren't the system's only checkpoints. You've also got a few special outposts placed at strategic entry points to particularly sensitive tissues, like those in the respiratory and digestive tracts. These are called mucosa-associated lymphoid tissues, or MALTs, because they can be found in mucous membranes around the body outside of the lymphatic vessels. Your tonsils are some of the largest collections of these tissues, which together form a ring around the entrance of the pharynx. There, they can inspect everything you eat and breathe and try to remove any pathogens before they enter the GI tract or lungs. It's a pretty big job, actually, which is why sore throats and swollen tonsils are a common sign of a cold or other infection. Another collection of malts, called Peyer's patches, are in the distal portion of the small intestine, providing another checkpoint along the GI tract. And contrary to popular myth, your appendix is not useless because it too contains a bunch of lymphoid tissue and is conveniently located where it can destroy any remaining bacteria before it can breach the intestinal wall during absorption. Exactly how your lymph and immune cells detect and destroy the unwanted visitors that might otherwise kill you is what we're going to be talking about for the remainder of this course. But for now, you learned how your unsung
Okay, so let's continue. The functions of the lymphatic system: it protects the body from foreign invaders. It transports and removes waste byproducts and abnormal cells from the lymph. It absorbs the fats from the digestive tract, and it helps maintain fluid levels in your body. Lymph vessels carry about 75% of the waste rejected by our cells. Here's another quick video on the organs.
The lymphatic system supports the cardiovascular system and functions as part of the immune system. There are three main types of structures in the lymphatic system: vessels, nodes, and organs and tissues. Lymphatic vessels can be found throughout the body. They collect lymph, a clear fluid drained from the body's tissues, returning fluid to general circulation. Lacteals are special lymphatic vessels found in the villi of the small intestine. You can see them in the villi microanatomy model. Fatty acids from chyme that is digested in the small intestine pass into the lacteals, mixing with lymph to form a special fluid called chyme. This fluid is how lipids get from the gastrointestinal tract into the bloodstream. Lymph nodes filter the lymph that passes through them, and they add white blood cells called lymphocytes to it. Lymphocytes, or lymphoid white blood cells, include B cells, T cells, and natural killer cells. We can see these different types of white blood cells up close in visible biology. B and T cells play important roles in the body's adaptive immune response to pathogens, and natural killer cells are an important component of the body's innate immune response. Now let's go back to Atlas and take a look at some lymphatic organs. The thymus is located just above the heart. Its main function is to serve as the site of maturation and specialization for T cells produced in the red bone marrow. It also produces hormones that regulate T cell development. The spleen is the largest lymphoid organ. It helps filter the blood by removing dead red blood cells and platelets and recycling iron. It also contains tissue where populations of lymphocytes increase. When I say the word tonsils, you're probably picturing the palatine tonsils, which are located at the back of the oral cavity. These small lymphoid organs help defend the body against pathogens. They have folds called crypts, where lymphoid cells accumulate and kill bacteria. The palatine tonsils aren't the only set of tonsils in the mouth and throat area. You can find other tonsils at the base of the tongue, the posterior wall of the nasopharynx, and the opening of the pharynx's auditory tubes. Want to learn more about immunity and the lymphatic?
Last video.
You know your body has its own version of a sewer system for removing unwanted toxins, waste, and excess water from the body. This is called our lymphatic system. Like our blood circulation, the lymphatic system is made up of millions of little vessels that branch all around our body. But whereas arteries and veins carry blood, The lymphatic vessels are much, much finer and carry a colourless fluid called lymph. Our lymphatic system has three main duties. 1. It contains white blood cells called lymphocytes, which are used to fight infection. 2. It acts as a one-way drainage system, transporting fluid from body tissues into the blood circulation. 3. It gets rid of waste products produced by cells. As blood circulates the body, plasma leaves the blood vessels and travels into the body tissues, delivering food, oxygen, and hormones to the cells. This plasma becomes tissue fluid and surrounds all our body's tissues. It then collects waste products, excess water, and toxins from the cells. 90% of this fluid passes back into the blood circulation. However, 10% of the fluid is left behind and is known as lymph. We therefore need a system to drain this lymph fluid so that we don't end up as a swollen fluid-filled balloon, hence the lymphatic system. The lymph fluid drains into lymph vessels, where it then travels to lymph nodes, which are found all around your body. To stop backflow, the lymph vessels have one-way valves and muscular walls that contract to force the lymph forward. This is happening in millions of little lymphatic vessels in your body every minute of every day. The lymph nodes filter the lymph, destroying or trapping anything harmful. The lymph nodes contain white blood cells called lymphocytes, which attack and break down bacteria, viruses, damaged cells, or cancer cells. This filtering and destroying is an important part of our immune system and stops nasty substances being fed back into our bloodstream, which would make us sick. The waste products and destroyed bacteria are then carried in the lymph fluid through larger lymph vessels up to your neck, where the thoracic duct empties the lymph back into the blood circulation. The bloodstream then removes the waste products from the body as it does with other waste. As well as the lymph fluid, our lymphatic system also includes a few organs: the spleen, thymus, tonsils, and adenoids. They all have roles in helping our body fight off infections. Unfortunately, like any sewer system, things can go horribly wrong. Sometimes we get infections that cause the pumping to break down. This can cause your arms or legs to swell to huge proportions. Sometimes the debris or other bad substances can make it past lymph nodes. Sometimes cancer cells do this and spread the cancer to other parts of the body, which obviously isn't good. For now, we wish you all the best for your lymphatic health.
Okay, so quick couple questions that you can ask yourself to see if you've got a congested lymphatic system is ask yourself, how do you feel physically? Are you feeling tired, fatigued, inflamed, or swollen? Do you notice slower thought processes, increased muscle soreness and stiffness, or increased allergies, sinus issues, especially upon waking? Or how do you feel mentally? Have you noticed an increase in brain fog or headaches or feelings of unmotivated or you're feeling depressed? Have you noticed a reduced ability to concentrate or a loss of memory recall? Are you feeling more depressed, anxious, or stressed out? How does your skin look and feel? Have you noticed an increase in the number of acne breakouts, blemishes, rashes, or irritations? Have you noticed that it has become dry, itchy, thick, and or leathery? And have you noticed any tingling feeling? And most importantly is, how does your body look and feel? Have you noticed that your body looks more puffy, that there's more roundness in your face, or that your rings don't fit like they used to? Have you noticed a change in the shape of your body regardless of your lifestyle? Are you having difficulty losing weight, although you've made diet and workout change and lifestyle changes? Have you noticed any irregular bowel movements, stomach aches, bloating, or stomach discomfort? These are all key signs of a sluggish, congested lymphatic system. And these are 10 typical ones: soreness and stiffness, headaches, bloating and digestive issues, chronic fatigue, skin problems, limb swelling, sinus infections and increase in allergies, brain fog, weight gain, muscle pain. So said in another way, what is ultimately going on is, as the lymphatic system becomes congested, The buildup of lymphatic fluid leads to a buildup of toxins surrounding the tissue. This will lead to an increase in inflammation in your body, and if not addressed, will cause chronic inflammation. In the functional medicine world and in holistic approach to working with patients, it is known that chronic inflammation leads to age-related disease. The disease and the early symptoms that develop and become present is all dependent on two factors: your genetics and where the congestion is present as far as the lymphatic system is concerned. So your genetics influence what diseases you are prone to develop because of the chronic inflammation. And then the congestion is also, if the congestion happens in your lower body, then you'll have symptoms that is present in your lower body. If your lymphatic system is congested in your upper body and you're prone to have developing age-related diseases in your upper body, then that's where it will happen. So always think of it, congested lymphatic system is equal to chronic inflammation, which equals age-related diseases. And this is another way that you can visualize it. So we start off with a healthy body. Our lymphatic system is bombarded with either viruses, bacteria, you have had surgery or some injury that congests the lymphatic system, or something else, some other pathogen or issue arises that causes a sluggish lymphatic system. That once that happens, then a buildup of the lymph and that metabolic waste remains in the tissues, which then result in some form of the top 10 symptoms of a slow congested lymphatic system. So how do you know if your lymphatic system is congested? There are several telltale signs that it is not moving correctly and that toxins are building up in your body. Simple issues that you have probably had at one point in time, such as swelling of the hands where the rings don't that normally fit are suddenly very tight. You notice lymph nodes in your neck when you are sick are enlarged. However, there are many other symptoms that can indicate a clogged lymphatic system that you might not know of. Soreness and stiffness. If you notice that you're often waking up sore or stiff in the morning, or that you notice that you feel pain that tends to move around from place to place in the body, this is all caused because the lymph builds up in the body, which is unable to it's unable to properly eliminate that metabolic waste, which leads to an increased inflammation. That increased inflammation is going to cause that chronic soreness and that increase in pain. Notice increase in headaches, that increase in pressure causing a headache because there is a lack of proper lymphatic and sinus drainage that is occurring in the head. The lymphatic system is also how the cerebral spinal fluid naturally drains out of the brain, taking with it the cellular waste byproducts and allowing room for the new fluid to be produced. So if the fluids that bathe the brain tissue are filled with toxins, they will increase the amount of inflammation that is occurring in the brain and thus increase pain throughout the head. You also will commonly see bloating and digestive issues being a subtle symptom of a congested lymphatic system. And that is because the gut is considered the second brain, and approximately 30% of our lymphatic system is linked to our gut. So constipation, bloating are a very common symptom of a congested lymph system, as well as unexplained food sensitivities, leaky gut, or irregular bowel movements. Chronic fatigue. Most common symptom with chronic fatigue is that the fatigue is severe enough that it interferes with your daily activities. And this is happening because there is a buildup of lymph, and metabolic waste will cause an increase in chronic inflammation, which usually is occurring in the brain. This increase in inflammation will prevent the cells from proper cellular replication and correct communication between neurons. Skin problems. So a buildup of lymph tissue or lymph fluid and toxins can result in several different skin problems, such as dry, itchy skin, acne, psoriasis, eczema. These are all indications that inflammation is present at the skin level, and approximately 70% of our lymphatic system resides directly underneath the skin. That's why when you go in for a regular massage, you're actually constricting the lymph vessels in the massage versus a lymphatic massage, which is a very light, gentle touch that helps to move the fluid out into the lymphatic system. Cold hands and feet sometimes can be attributed to a backup of this lymphatic system. So we also have limb swelling. Swelling can occur in all or part of a limb or any other part of the body. It can be very difficult to fit into clothes, and jewelry and watches can sometimes feel very tight. At first, the swelling may come and go, and then become more chronic as the congestion progresses. You might experience achiness, a heaviness in your legs or extremities, difficulty with movement, a decrease in range of motion because of the edema present, repeated skin infections, hard and tight skin, folds developing in the skin. You'll notice pitting edema. You could also notice non-healing wounds developing as well. And these are three really great examples of what that would look like in individuals. Sinus infections and allergies, an increase in those. Frequent sinus infections and worsening of allergies. The feeling of having that stuffy nose, congestion, a lot of mucus being produced, especially upon waking in the morning. Increased occurrence of colds and flus because of a weakened immune system. Sometimes even dental infections might also point to a backup of your lymphatic system because there's an imbalance of bacteria occurring in your mouth. Brain fog is also very common, subtle symptom of a congested lymphatic system because the lymph fluid is not draining correctly, and plaques and other toxins build up in old cerebral spinal fluid and make us feel groggy, confused, and lethargic. Similarly, depression has also been tied to a clogged lymphatic system. And weight gain is the most common, most sought out reason for getting treatment for the congested lymphatic system, because the buildup of the interstitial fluid happens in the body, causing an increase in body fluid and an increase in the size of the tissue. The buildup of this fluid will increase the inflammation in the area, ultimately increasing the number of adipose tissue and fat cells present. Muscle pain. The buildup of metabolic waste can cause an increase in inflammation, which is going to cause an increase in pain. And this can happen throughout the entire body. So long-term complications of a congested lymphatic system. Disorders of the lymph flow often lead to serious diseases. The most frequent of these is lymphedema, which affects mainly the extremities. When a disorder of the lymph drainage develops, protein-rich fluid accumulates inside the tissue. This increased levels of inflammatory cells, these monocytes, migrate to the area. They then transform into macrophages and multiply. The macrophages will produce an increased amount of signaling substances, stimulating fibroblasts to divide and synthesize more connective tissue. These connective tissue can then get transformed into lipid-storing adipocytes or your fat cells, as well as scar tissue. In the late complication of lymphedema, the increased proliferation of these fatty tissues and fibrosis lead to what we see. Therefore, the long-term effects of having an increased level of inflammation results in increased level of adipose tissue, i.e. your fat cells, in these patients. Lymphedema versus lipedema. This is a fantastic diagram of the differences between the two. So when you see a client that has, or a patient, or you know somebody that has one extremity larger than the other, they are going to be lymphedemic patients. And when it comes to lipedema, their body parts actually almost look like belong to two different people, but they generally affect both sides, and there's usually pain associated with lipedema, where with lymphedema there is not. And one big difference is that with lymphedema, the typically the hands and the feet are not impacted. So with lymphedema, you'll see swelling of part or all of the arm, including fingers and toes. They will report feelings of heaviness or tightness. There's a restriction of range of motion. Reoccurring infections are very common, and you'll see a hardening and thickening of the skin. The symptoms range from mild to severe, and lymphedema caused by cancer treatments may not occur until months or years after the treatment. So, and this is all happening because of an improper lymphatic drainage. These are the different stages, and stage 4 is the worst. Symptoms of lipedema, are fat buildup in the buttocks, thighs, calves, and sometimes even the upper arms. Diuretics elevating your legs and support stockings do not usually help the affected area. There is typically no swelling in the feet and the hands, unless the patient also has chronic venous insufficiency or lymphedema. Sometimes the two diseases will correspond to one another. Pain is associated with these individuals. As the condition gets worse, lipedema can affect the ability for these individuals to walk. Many patients with lipedema have an emotional component to this because they feel very embarrassed, anxious, depressed, as the lower part of the body typically grows larger than their upper body and looks like they belong to two different people. Over time, more fat will accumulate, and it can block the lymphatic pathway even further. This causes a buildup of fluid called lymph, obviously, and the condition is known as a secondary lymphedema or lipolymphedema. The fat cells inside these individuals are actually very different than regular obesity and regular fat cells. So we've got the different stages. There are 5 types of lipedema. Type 1 is going to occur in the buttocks. Type 2 is going to occur in the buttocks, hips, and thighs. Type 3 will be buttocks, hips, thighs, and calves. Type 4 will occur in the arms, and type 5 will occur in the calves. So what is the BallancerPro? The BallancerPro is the Rolls-Royce of lymphatic drainage technology. So jump into a pair of the pants and begin your journey and finish the session in our jacket for a complete body treatment. The extremely relaxing experience will bring aesthetics as well as wellness results like no other, and it can be compared to being massaged by 24 masseuses at the same time. The BallancerPro works by increasing circulation and supporting the lymphatic system by returning the interstitial fluid to the cardiovascular system, and it can be also viewed as an external heart for the lymphatic system. It's originated in the medical field and is backed by over 40 years of proven clinical studies. It is the state of the art. BallancerPro is known as the gold standard for lymphatic drainage. Users enjoy an extremely relaxing and comfortable experience resulting in aesthetics and wellness benefits that are long-lasting. And it will help to enhance circulation and recovery. Reducing muscular aches and pains are just some of the endless benefits that the lymphatic drainage brings to our bodies when we're utilize the BallancerPro in supporting the lymph movement. Top-tier surgeons, medi-spas, weight loss centers, body contouring clinics, and the best integrated medical centers, as well as professional sport teams, rely on the BallancerPro for its ability to highly improve multimodality treatments, providing consistent results and happy returning customers. Expanded applications, possibilities ranging from red carpet treatment, bridal prep, to detox and relaxation, body contouring boosters, or any athletic recovery. Basically, anybody with a body can benefit from utilizing the BallancerPro treatments. So, diving in a little bit deeper, Anyone who has or who is healing from a recent surgery or suffering from any type of lymphedema, lipedema, gut and digestive issues, edema or swelling, chronic inflammation, pain, fatigue, suffering from any injuries would benefit, as well as anyone about to undergo liposuction treatments or has recently underwent liposuction treatments or any type of plastic surgery can benefit from utilizing the BallancerPro treatments. Anyone experiencing muscle fatigue or anyone who has spent a prolonged time on their feet or who is about to undergo liposuction treatments. As I had said, when plastic surgery will benefit from the treatments. Cancer survivors that have had their lymph nodes removed will also receive benefits by removing that interstitial fluid. Or if you've got anyone looking to reduce a dress size in a very short amount of time and look better for a red carpet event, for muscle recovery or to enhance their performance, to reduce inflammation, for a full body detoxification, or anyone looking to improve or prevent the appearance of cellulite or varicose veins, to support their immune system. Anyone looking to have a relaxing massage, or anyone looking to speed healing from a recent surgery or promote total body well-being, or to promote body relaxation and mental wellness. They'll have benefits from utilizing the BallancerPro, as well as enhancing the results from their body contouring treatments. So users enjoy an extremely relaxing and comfortable experience that brings an aesthetic and wellness results. Depending on the desired outcome, less is more in most cases as far as the pressure is concerned, and should feel like 1,000 butterflies fluttering over your body. After treatment, you should feel relaxed and lighter and more rejuvenated. So some of the benefits as far as aesthetics are concerned is you can lose 1 dress size or more with 12 treatments. It helps to support weight loss, helps to relieve leg pains due to obesity and hard work, improve the shape of the legs, arms, and buttocks and belly, improves the appearance and tightness of the skin, reduces the appearance of cellulite and prevents the accumulation of cellulite. It helps to flush out the metabolic waste and fat from our bodies and prevent and treat varicose veins. The benefits for athletic recovery would be reduced limb and body swelling, can potentially prevent injuries from occurring. It helps to speed the recovery process by increasing the removal of metabolic waste and lactic acid. It enhances the results of other recovery modalities that you're utilizing. It increases blood flow and massages the muscles. It reduces the buildup of scar tissue. It speeds healing of injuries and reduces the time off of injuries. The benefits for wellness. It'll help to prevent and treat varicose veins, relieve leg pains due to obesity and hard work, reduce limb and body swelling, increase the support of the immune system, helps to support the body's ability to remove toxins, helps to reduce muscle soreness and pain, helps to combat chronic and acute inflammation, and it helps to improve relaxation, stress, and mental well-being. In between your BallancerPro sessions, you can do some home care. At the cover, we have 2 options. The best-selling option in sleepwear would be our lymphatic flow enhancing luxury sleepwear. It is infused with 24 karat gold nanoparticles and hyaluronic molecules, which will help to improve the collagen and the elasticity of the skin. And it will also provide 10 to 15 millimeters of mercury for a gentle, light grade lymphatic flow, enhancing the compression. So it helps to support the lymphatic system. And ideally, you want to wear it for about 8 hours to help increase skin hydration and elasticity. It's very soft and feels luxurious. Then the other option is our activewear, and the BallancerPro activewear is our best seller as far as activewear is concerned. This will provide a medical grade 2 compression which is 25 to 30 millimeters of mercury of compression. It is made in Italy of the finest, most comfortable microfibers that deliver a graduated compression towards the thoracic area. It's engineered to support lymphatic drainage and blood circulation as your body moves by enhancing the muscle pump effect. And it is absolutely amazing. I love to wear it, especially when I fly. Now, in order to utilize all these greatness to help support your lymphatic system and your general health and wellness, we have several different options available. So in our membership packages, we have 3 different options for your starter memberships, which is Explore, allowing you to come in and use our Glow compression 3 times in a month. Our Enhance program will allow you to come in 10 times in a month. And our Evolve will allow you to come in and use any 3 of our foundational services every single day. So if you are going to want to support your lymphatic system and you're going to start with one of these 3, the only option available to you would be our Glow Pants. So if you are just wanting to, you have general health and wellness and you just want to support and see what a compression lymphatic system is all about, then I would recommend starting at the Explore. If you want to start to see some results, I would move up to the Enhance program. And of course, if you really want to maximize the results, I would move up to the Evolve and use it every single day. You also have an option for a single unlimited. And again, this is somebody who wants to maximize the results of the Glow compression pants. Or if you have either Explore, Enhance, or an IV membership with us at the Recovery, you can do an add-on unlimited, which will allow you to use the Glow compression daily, regardless of which membership you have. And then we have our premium services. This is the only way that you'll be able to actually utilize the BallancerPro at our facilities in 2022, I think is what this year is. The year is all merged together for me. So we have a single treatment option. This will allow you to use the BallancerPro device for a single 30-minute session. This is somebody who just wants to verify, yes, I can in fact stay in the BallancerPro. Or if you're just in town and you only have 30 minutes. Ideally, this is not an ideal option for the majority of individuals. We have the 5 treatment package. This will allow you to use the BallancerPro for 5 sessions, helping you to reduce the cost per session. This is somebody who wants to be on a maintenance program where you're coming in once to twice a week and you're just helping to support general wellness or maintain the results from any of your treatments. And then the most common option is going to be the 10 treatment option. This will allow you to use the BallancerPro for 10 sessions, reducing the cost, and it gives you the lowest per cost. This is really the best and only option for long-term change in the appearance, in body contouring appearance, and for recovery or anybody that has a lot of issues going on. Most individuals will need multiple treatments to reach their desired goals and outcomes. And that is it for today's presentation. I just want to thank you very much for your time. And I forgot to mention that my name is Ryan Martin. I am the Director of Training and Education at the Recovery. And if you do, in fact, mention this presentation, you will receive a free consultation to determine what are the best options for you as far as reaching your goals and your outcomes, and a free 10-minute demo of either the Glow compression pants or our BallancerPro. Thank you again so much for your time, and I look forward to seeing you at one of our locations across the nation.